Good morning, everyone, and welcome to Live from the State Capitol. I'm Peter Peretzman, Chief Communications Officer for the New Jersey Business and Industry Association. With us today are Michelle Sikurka, President and Chief Executive Officer, and Melanie Willoughby, Chief Government Affairs Officer. Yesterday, Governor Christie delivered his final State of the State message. Today, Michelle and Melanie will discuss and analyze the speech. A few housekeeping matters before we get started. Today's webinar is being recorded and will be emailed to you automatically in the next day or so, along with the slides for today's presentation, so you should be on the lookout for those. If you'd prefer to download them now, please see the PowerPoint link toward the lower right-hand section of your screen in the Handouts tab. Above it, you may also notice the Questions tab. Michelle and Melanie would be happy to take all of your questions, so don't hesitate to write them in as they come to you. Yesterday's State of the State was a little bit different than usual in that the governor spent most of his remarks on only one subject: drug addiction and treatment. Not only is drug abuse breaking apart families and communities, it is also a difficult issue for businesses who must deal with employees who are addicted. In today's presentation, Michelle will discuss the economic aspects of the governor's remarks, and Melanie will take a look at the drug addiction and treatment proposals. So now let's get things started. Michelle?
Hi, good afternoon. Well, good morning, everyone. Thanks for joining us today. Yes, the State of the State was very interesting yesterday. Those of us in the business community ordinarily at this point in time look forward to hearing more about the economic state of the state, the forecast going forward, how the state is faring fiscally and otherwise. And we did hear some of that yesterday, and the governor did, in fact, talk about some of the celebrations, if you will, of the 2016 policy agenda that did, in fact, benefit New Jersey's business community. Here at NJBIA, we are very excited about the 2016 business wins, as we call them, and the opportunity for the first time in a very, 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 very long time, perhaps too long, for some comprehensive tax reform. But before I go too specific into some of those, we have a feeling of what the state of the state is here at BIA, and some of which, what we didn't necessarily hear yesterday, though we are always bullish on New Jersey, and I think everybody knows that we live and breathe bullish on New Jersey here at BIA and advance an agenda to keep New Jersey moving forward. But when we look at the state of the state today, and we know our members told us coming into 2017 that they're optimistic about 2017. They're looking forward to increasing their sales and their profits. They're going to give raises, and all indications are that 2017 is going to be a positive economic year in the state of New Jersey. But we can't ignore the backdrop that comes across. And when we talk about a snapshot in time of the state of the state, unfortunately we have to be pragmatic and still recognize that we are the highest tax state in the nation, that we have a significantly high cost of living, and affordability is the agenda that we need to be paying attention to. And we're going to talk a little bit about that looking forward after some of the comments from yesterday. But this is an expensive state, and it continues to be. And we know that as a result of this highest taxed in the nation status that we have and our overall cost of living, that we are still suffering out migration in the state of New Jersey. And over the last 11 years, we suffered over $20 billion of net adjusted gross income out of the state of New Jersey. So while we're going to rally around the successes from last year, we need to know that that was just a start, and we have a lot of work to do in the state of New Jersey. Let's start with one of those successes for last year, what we call the first step in comprehensive tax reform. Late in the year, almost right before the end of the year, in fact, late November, there was a bill signed by Governor Christie that had bipartisan support, and we again thank our courageous policymakers for stepping forward with the comprehensive tax reform bill that, yes, while it did increase the gas tax, though making an investment in infrastructure that is significantly needed in the state of New Jersey. In exchange for that, we got tremendous tax reform, and that tax reform included an income tax cut for our retirees. It included the start of elimination of the estate tax, which will be eliminated 100% from the state of New Jersey December 31st, the end of this year, 2017. For this year, the threshold went up to $2 million. It also provided an income tax deduction for veterans, an increase in the earned income tax credit for our lower wage earners. And as a result of this package, we also know now that CPAs and analysts and advisors who at this time of the year are informing their individuals and their businesses as they look forward to the best tax planning you can do for a year ahead. Oftentimes we're said, hey, you got to consider leaving the state of New Jersey, and we know now that our CPAs are saying, you know, no, not so fast. There's actual reform going on in the state of New Jersey, and as a result of that, you can consider staying here, and let's look at what that looks like for you. So this comprehensive tax reform package, again, I can't overstate that it is a game changer for the state of New Jersey, and already we have heard from many of you, our members, we've heard that you are taking a pause on your exit strategy button to say, I can now reconsider staying in the state of New Jersey thanks to this comprehensive tax reform. I want to pause one more moment here because we know that there was a lot of talk around the gas tax increase and some grumbling out there about, my God, how do you talk about affordability and yet raise the gas tax? And I just think it's very, very important that we recognize what the investment will be for New Jersey as a result of investing in our infrastructure, and what this new spend, now that we've locked it up in the ballot question, what this new spend means for us in the state of New Jersey. The economic impact on investment in infrastructure will be approximately $2 billion per year economic spend. From that, we can estimate over $4 billion in economic output, over 34,000 jobs created. That means over 1 billion jobs in wages. And when we create wages, what do? We tax them. So that means the tax income back to the state, payroll tax will be about 16 million, income tax about 93 million, and about 40 million in sales tax. Now that's an average spend number. This is significant for the next 6 to 8 years in the state of New Jersey, and I think if we marry that investment up with what we're hearing now, the signals out of our federal government and the new administration, and Trump's desire to make a significant impact on infrastructure investment as well, I think we could be well poised here in New Jersey to see even more good coming from that. So, you know, I'd ask you all to consider, marry all those economic factors together. The fact that we're going to keep more people in New Jersey, the fact that we're giving relief to our seniors and those contemplating retirement, and the fact that we're going to have this economic boom, if you will, in our infrastructure investment over the next few years. And I think New Jersey is poised for some really, really awesome stuff. What else did the governor talk about yesterday? He highlighted some significant economic recovery numbers for the state of New Jersey. 5% jobless rate, which today is half of what it was when this administration started. Now, we've heard over the years that, you know, New Jersey lagged coming out of the economy, and that was true, but at this point, we have caught up, and that is very significant. We are back to our pre-recession numbers. Again, other states may be ahead of us. That is true. We had significant things impacting us over the past years, aside from the recession, as you all know, and you've heard us talk about it. You know, we can't ignore that we had Irene and Sandy. We can't ignore the decline in Atlantic City. I mean, those things, the impact on our tourism industry for 2 or 3 seasons, absolutely significant. So I think we should be celebrating today the fact that we are half the rate of what we were in 2010, and again, another positive sign for New Jersey's economy. Home sales rose 15% in the last year. This is very important. You know, in a stagnant economy, you don't see home sales on the increase, and you don't see property values increasing. And this is good news for New Jersey because, you know, unfortunately, we are still the #1 foreclosure state in the nation, but if home sales are rising, that is a great indicator of good economic times coming. $2.3 billion cut in discretionary state government spending. The governor spent a few minutes talking about the fact that through attrition at the state level, state worker jobs were cut significantly through this administration. I think he said 10,000 jobs, if I remember correctly. And having, you know, been at DEP, I did live through that actually. Every time we had job openings, you know, coming up, because a lot of people were retiring, they were not being filled 1 for 1. In fact, they weren't even being filled 1 for 2. We had critical hire lists, and that rehire process was a very challenging process because there weren't that many positions being created. So I can tell you firsthand, doing more with less in government absolutely was the mantra, and we're seeing that discretionary state government spending, you know, reaping return again back to the economy. The governor also made note of the fact that the 2% tax cap at the local level has driven additional savings in terms of municipal employees at the county and at the local level as well. And then $6.3 billion paid into the public pension. Now, this is very significant. We know that the pension right now still needs more investment. We know that we're still lagging. We know this is still one of those albatrosses around the neck of New Jersey that we have to take care of. This is an obligation that we can't ignore. However, it is the case that this $6.3 billion in this administration alone since 2010 is more than a combination of any other of the administrations put together over the past 2 decades. So, while the governor has made commitments to fund, the governor has done it, in a way that New Jersey could afford. And yeah, we're going to continue to play catch up on this, but I believe the governor said in this next year another 1.9 is going to be put in. So this is significant, playing catch up, but absolutely at a pace much faster than we've done before. Based on that, that state of the state and where we find ourselves today, we're in a very strong economic position in the state of New Jersey. We're still facing those challenges as I outlined at the beginning. And so it is significant for us now that we look forward and say, what's the next big thing? What is the agenda for 2017? How do we continue to do something with this great tax reform momentum that was created at the end of 2016 in order to carry that forward to address some of other New Jersey's fiscal issues? Well, here at BIA, we are looking forward to finding comprehensive solutions to this property tax issue that we have, being the nation's highest. We are doing research right now around what are some of the solutions that may help to drive us to a comprehensive agenda toward property tax reform in the state of New Jersey, and we ask you to stay tuned and see what we have coming for you in that. We started with estate tax relief, and we were very successful in getting elimination by next year, but you know what? We can't forget that state inheritance tax is a tremendous burden for New Jersey residents, an extremely regressive tax that starts at $1, and we need to look at reforming the inheritance tax. We learned through our initial research in this area that there are many provisions in the inheritance tax laws that are extremely archaic, that if we bring reform to that, it's not necessarily going to mean a hit to the budget of the state of New Jersey. So we think that there's some low-lying fruit. We are not making a commitment today to say that we're going out to advocate for elimination, but what we are saying is that we are studying the arcane nature of today's inheritance tax laws to see how we can bring relief so that this is more equitable to New Jersey's residents. One thing we identified, and you've heard us speak about this before as part of our out-migration study that we released February of last year, almost a year ago, is that New Jersey millennials were the #1 out-migration group for the state of New Jersey. Now, they're not only the #1 out-migration group from the state of New Jersey, but those millennials, they are the #1 group out-migrating across the nation. So let me say that again. New Jersey's millennials, New Jersey is #1 in millennial out-migration, those aged 18 to 34. This is a significant challenge for us in the state of New Jersey. I think about all the things that go around. This is our future workforce, and we need to pay attention to keeping the 18 to 34-year-olds in the state of New Jersey. To that end, we are identifying a comprehensive agenda that will talk about a higher ed strategy, that will talk about our continued work on workforce development, and basically how do we pathway individuals through their entire education into career, whether it be through higher ed or otherwise. And on top of this, again, is the affordability agenda. We must have affordable housing and opportunities in the state of New Jersey for millennials. Now, you just heard me use the term affordable housing, okay? Please don't go to the connotation that we immediately go to in the state of New Jersey when we talk about affordable housing. We are talking about workforce housing. We are talking about housing that those graduating from college, that those who choose to stay in the state of New Jersey, today, 65% of high school graduates that are going on to college are leaving the state of New Jersey to pursue their education elsewhere, 65%. Now, if they come back, and those that stay, another unfortunate statistic is they're living with their parents. This generation can't afford to get out on their own. So those that are staying or coming back, New Jersey is the #2 in the nation of having millennials living home with their parents. We need to find a way to create affordable housing opportunities for our millennials. We need to look at the housing stock we have in the state of New Jersey. We need to challenge ourselves on whether or not that is attractive and of course affordable to millennials, and we need to start doing something about that. So this millennial strategy has about 3 or 4 legs to the stool, and we'll be putting that agenda together. And then finally, not just for millennials, but as we keep talking about, affordability is the name of the game, and we must make New Jersey more affordable for our residents and our business, and this is the agenda for NJBIA as we go forward. So in wrapping up my beginning statement on this, we were very excited about the successes in 2016. We were very happy to celebrate with the governor comprehensive tax reform. We were very happy to be a leader in bringing estate tax relief and relief to seniors in the state of New Jersey. And we look forward to a prosperous 2017 and a BIA agenda that will drive us toward affordability.
Thank you, Michelle. And I look forward to continuing the work in 2017 with the government affairs lobbyists who have been extremely active in ensuring that we're trying to make New Jersey affordable for our businesses. Now let me turn to the governor's State of the State, which was unusual in a number of ways. And one of them was the amount of time that he spent actually on his accomplishments, economic and project-oriented for 2016, and what he was planning on for 2017, as much as he spent more than an hour of his speech on the fight of drug addiction. As many of you probably know, reading in the newspapers, you've seen that this has become one of the governor's key plans for trying to ensure that New Jersey is addressing drug addiction, which impacts our families, it impacts our employees, and it impacts everyone because it is not just an issue that impacts certain sections of the state or certain types of individuals, it impacts everybody. And I think that was an important issue that the governor made because he said that it's a crisis which is destroying families. And one of the only funny lines that the governor had in his State of the State was when he was talking about his economic issues in which he was successful. He did say, if you want to know any more about it, you can read my book. And if you might recall, he was trying to get a book deal through the legislature, so that did bring a laugh in the State House. So moving on to his program, because this impacts our employers very, very directly because of the fact that these are your employees. And so I want to go through what are some of the aspects of the plan so that everyone in the business world is aware of what they can indicate to their employees as our options for them on how to reach help and what they can do for helping their employees as well. So first of all, there is the establishment of a statewide web portal and helpline, which really is a way of consolidating all of what the government has to offer into one easy website, as well as one easy telephone, which is a 24-hour-a-day, 7-day-a-week helpline. And so this is confidential, but it's going to provide resources to provide treatment locations, insurance guidance, tips on support programs for those in recovery. And so this is really, I think, one of the key cornerstones of his plan to fight drug addiction. The next is actually making treatment beds available for 18 and 19-year-olds, which you might say, well, that's interesting. Why would he do that? And that's because presently state licensed treatment facilities do not treat 18 or 19-year-olds. And so we know that many of our drug addicts do start early. They start, as teenagers, and we need to address it early in their life in order for them to be able to lead a successful life. So the Department of Children and Families will expand its residential services for 18 and 19-year-olds, and this is actually going to be about a $12 million investment to be able to open 200 beds to hundreds of young people who are seeking help. Now, the next is about providing options for substance-free housing. Now, this is for our college students, because many of them have been caught in the drug epidemic, and so there is actually going to be a program for our college students who exit treatment but cannot stay in recovery in that college environment, and the governor is going to be providing help for them in having substance-free housing. which actually could be very helpful for our college students. Then we're going to be going into expanding increased prevention efforts that will include limiting the opioid prescriptions written by doctors and dentists to a 5-day supply. This is a big move because presently it's a 30-day supply, and yes, there is legislation presently in the legislature to limit it to a 7-day supply, but it has not gotten out of committee. Now, I understand that the governor will not necessarily need legislation in order to get this done, that he actually could really authorize it being done within the Department of Health and Human Services. Then, going on, the governor is creating a task force on drug abuse control. This is actually going to be led by his former chief counsel, Charles McKenna. And this is actually going to be a task force on drug abuse to mount a coordinated attack by working with all areas of state government, because as you know, the government is a very big bureaucracy, and there are many agencies within the government that actually deal with it, and this is going to be coordinate all of them to bring them all together to actually deter narcotics trafficking, drug diversion, drug abuse, and drug addiction. So it's very multifaceted. Then they're going to actually expand the Pediatric Behavioral Health Collaborative because of the fact that, I mean, the statistics are astounding on how many of our children actually become addicted because they may have an injury and they get prescribed an opioid and then they become addicted. And this can happen to our youngsters who are playing soccer, to those who are playing field hockey. It can happen very young, and then they are going through high school and they are addicted. So what this is going to be trying to provide a telehealth hubs for psychiatrists on call for our pediatricians. So I think this is also going to be very, very helpful. Then we're going to, the next part was about breaking barriers to employment of recovering drug abusers. Now, NJBIA was already very active in trying to, quote unquote, ban the box on all employment applications, which means that if you have a criminal background, that you would not have to indicate to the person that you're applying for a job that that was the case until you got your offer. So this also relates to drug abusers because many of them do have, unfortunately, have served time. So this is an opportunity for being able to provide them with another chance. And so in addition to this already being law, the governor is actually going to bring together an employment opportunity summit in March, don't have a date yet, in which he will bring businesses and HR professionals and everyone together to really talk about how recovering addicts can get back to work. And so this is one of the highlights the governor sees as his opportunity to work with business to try to open those doors, because as the governor said, really the best opportunity for addicts not to go back into their addiction is for them to have a good paying job. And so he wants to really highlight that, and NJBIA looks forward to working with the governor and his administration on this summit, certainly. He then indicated that he wants to partner with the feds to really treat addiction more effectively, and that's in order to try to draw down more federal Medicaid funds. And that's because, interestingly, you know, there's all these little points that in regulations that government has that are so bizarre, but this one is that Medicaid funds cannot be used for people who are getting inpatient substance abuse treatment in a facility with more than 16 beds, because those facilities are categorized as institutions for mental disease. Another regulation that is obviously absurd, and the one that the governor seeks to work on trying to change with our Human Services Commissioner, as well as with the Centers for Medicare and Medicaid Services. So we wish the governor good luck with that. Then the last is ending the stigma that is associated with addiction recovery. And this is really so important because of the fact that, an addiction is an addiction is an addiction. If you're addicted to drugs, if you're addicted to alcohol, if you're addicted to cigarettes, that these addictions, it's taken a painful road to trying to ensure that it is not viewed in a negative way, but that these individuals who are all part of our family and our work environment need help. And that, we know that the ADA, the Americans with Disabilities Act, does recognize alcohol as a protected group, that if you are addicted to legal drugs, that also is protected. But if you're addicted to illegal drugs, you're not protected under the ADA. So there are interesting elements of the law that we all have to take a look at. But what I want you to know is that NJBIA is completely committed to working with the governor on his plans, and where we can to be ensuring that the word gets out to our employers so that you can provide the information to your employees so that they have options and so that you do too. Because we know that the costs of drug addiction are many. It does add to the high absenteeism. It can really be about increased disability insurance costs. It can be higher workers' compensation costs. It can be a productivity issue, and it can really have a destabilizing effect on the workforce, especially when your employees have family members who are suffering. They suffer too, and your productivity can suffer. And so it really hurts the overall state of our economy. And so that is why we will work together with the governor and the legislature in trying to ensure that many of the governor's proposals see action. And so at this point, I'd like to see if anyone has any questions and Michelle has any additional comments, and we can open it up to our audience.
Okay, thank you, Melanie. Thank you, Michelle. And I guess just for Melanie, the obvious question is, so these are very important issues, and already some of the dialogue has started from some of the stakeholders, I guess, showing concerns about costs, which throughout our history, we have always sort of kept an eye on mandates, healthcare mandates, and really being very careful about what is included in sort of mandatory health insurance and health benefits, because that impacts our members. So in this type of case, how do we, as an association, how do we balance those two very important and sometimes competing issues?
Peter, that's a really good question because of the fact that one of the elements of the governor's proposal is to mandate that there be a 6-month allowance for treatment, inpatient treatment. And we know that many of our members and our insurance company members are taking a hard look at this to see what the possible impact would be. The governor did ask the legislature to act on this in 30 days. That is certainly a robust time frame to get anything done in the legislature, but I think that we're going to be taking a look at it because, yes, that is a mandate. And mandates always need to examine what the science is behind that mandate, what the costs are behind that mandate, are there alternatives, and what the medical necessity is. So we're going to be taking a hard look at all of that and certainly interacting with the legislature on that.
And Melanie, just to add, today there was a statement by Assembly Minority Leader John Bramnick that he is going to be the one proposing the bill on the 6-month mandate. And so it's very interesting because in ordinary times, and I don't even know what ordinary means anymore, sometimes we feel like we live in an alternative universe. Of course these issues are significantly important, but it's not common that it would be a Republican legislator who might be advancing a mandate. So it'll be interesting in understanding the concerns around mandates, because if you just look philosophically, historically it seemed that side of the aisle was the side of the aisle that would be opposed to mandates given costs and impact. I'm hoping that because it's coming from that side of the aisle, that there will be a predisposition to the concern around cost, et cetera, and we might see something different than we might see in an ordinary mandate bill, where ordinarily we are then put in immediate defense position, unfortunately, of jumping up and taking what might appear to be an adverse position, yet we are hoping, right, that we can be a part of the discussion early on this, so we can help to inform what might be the right way to go about this, so we don't wind up being put in what might be our historical mandate corner.
Well, that's a good point, Michelle. I also want to bring to everyone's attention the fact that there is a New Jersey Mandated Health Benefits Commission on which actually NJBIA has a position. And that mandate commission is where typically we ask all legislators to refer all mandate bills so that the science behind the requested mandate can be reviewed by experts. And then can be costed out, and then you can do the balancing act. We don't make a decision within the Mandate Commission. We merely examine it, and then we give it back to the legislature for them to be able to make a decision. I would really hope that it would be considered, and we will certainly ask the minority leader for him to refer that to the Mandate Commission. We can act expeditiously, certainly, but I think we need to have some science behind what this mandate is.
And I think as our members have come to expect from BIA, we will be looking at the economic factors and trying to weigh, because what I would hope we would find at the end of this is, while there may appear to be a cost up front for moving in the direction of something that is so needed, that the economic impact on the other side, i.e. what we're going to avoid by having a more productive workforce and employees that aren't addicted and people that are well taken care of, that we're going to see an economic positive on the other side of that. I know that's what we'll be looking for, and we'll probably be doing some of our own independent research, here in order to ensure that we are comfortable with that as well.
And Melanie, I know that we're going to be looking for input from our members, and we're going to be reaching out today. So why don't you, for those who are listening with us right now and those who will be listening in the next few days, why don't you tell our members exactly what we're looking for and exactly what kind of input we need them to provide to us.
Thank you, Peter. We are going to be asking our members, and it's actually going to be going out in our daily email at 4 p.m., our NJBT, New Jersey Business Today. We are going to indicate that we really need to have their assessment on the impact of the 5-day supply, which is what the governor's recommending, and as you know, it's 30 days now, and their thoughts on that. We're also looking for their input on the 6-month mandate for inpatient care for drug addiction, and what the impact that will have. We have gotten some comments from some of our members already, but we're going to be looking for them to be really responding to us on those.
And can I add to that that I think we would also like to have, if there are any case studies or stories that perhaps our members can share with us. I always call it the boots on the ground. Let's get out into the business place. Let's find out who is being affected on the ground. Let's hear from our members, because unfortunately, I'm going to venture a guess that there are stories out there. But understanding those stories and how some of our members may have worked through these types of challenges could be helpful to us in helping to inform the process going forward. The more we can be a part of the discussion and the more we can understand the boots on the ground impact and what people are experiencing right now in the workplace, because this is an epidemic of profound proportion. I mean, it's not just New Jersey, unfortunately, it's a national epidemic, but here in New Jersey, given our demographics, et cetera, things always seem to be echoed even more here.
Right. The most employers, large employers, certainly have a EAP, an Employer Assistance Program. And what I see as the governor is proposing here is a way for small employers to also have an Employer Assistance Program for their employees by having all these resources at their fingertips.
And Melanie, you touched on an issue that I also wanted to explore, which is it's not only the cost of all these proposals, it's not only the serious issues of drug addiction and treatment, but this also represents for our members a potentially significant workplace issue. Our members, I'm sure, all the time deal with employees who have substance abuse issues and must deal with it in one way or another, whether it's helping the individual, which we, I guess, would hope is the case, lack of productivity, and the ultimate, which is hindering them from doing business to the extent and being as successful as they'd like to be. So how do you weigh that factor in particular against the cost, against the societal benefit of providing these services? Because again, this has, the productivity angle has a direct impact on our members.
Yes, productivity certainly is a critical component of every employer's day, but we're also talking about a addiction that impacts all socioeconomic classes that needs to be addressed, and I think employers can play a big role in helping their employees to find help, and also helping their employees to have help for their family. Because, as I said before, when you have an employee whose family is being torn apart by this, that by helping that employee, you are making an employee much more loyal to you because you have a heart. And I think that sometimes that's really also critical in the workplace.
Now, Melanie, this is obviously the governor's plan, not necessarily the legislature's plan. So how do you assess moving forward? Is this necessarily going to be a priority of the legislature because the governor gave it such visibility? We know they have a ton of other competing issues in a gubernatorial election year. We saw the press conferences yesterday where they went, spent 2 minutes on drug addiction and treatment and then went to school funding. So where does this fall in the list of priorities, and are we really going to see any movement on this, do you think, in really the last year of an 8-year administration?
Actually, most of what the governor proposed does not need legislative action. The only thing that he proposed that needs legislative action is actually the new mandate for insurers to provide the 6 months inpatient care. So that's the only action they have to take. The 5-day supply, no, he can do that administratively, setting up his task force administratively, his summit administratively. Most of it is all administrative. So I think that the legislature really is not going to have as much of a need to take action. But as for how the Democrats responded to the governor's proposals, they said yes, they recognize drug addiction as being a crisis in the state, they recognize it needs to be addressed, they applauded the governor for that, and then they pivoted and said, in terms of the issues that are really plaguing New Jersey, this is only one of them. And then they proceeded to talk about property taxes, school funding, the crisis of our cities, how we get people back to work. So they did talk about a lot of their core issues and those that need to be addressed, as well as drug addiction.
And I would ask Michelle the same question in a different way, which is, we have been talking about comprehensive tax reform. We've been talking about what the next steps are. How do you assess how that fits in with all of the discussion that's going on right now? Is there an appetite to move forward on some of these things? Is it going to be waiting for a next administration, or is there going to be room to have that discussion, do you believe?
Well, I think that 2017 is somewhat already of a transition year, which is typical when you're coming to the last year of an administration, and everyone is now jockeying for their positions for a new legislative year and a new administration. The entire legislature is up this year, so all our policymakers are going to be very focused on their campaigns. And we've already heard indications about things that we don't anticipate are going to see action this year, like minimum wage, for example. The good news about that is, the first thing people might say is, great, minimum wage discussion this year, how about it, and get excited. However, what it really means is we're put in a position of having a year to work with our policymakers on establishing good agendas toward the things that are important to us. So having this time now to build our agenda, make our case, get our data, etc. Oftentimes an organization like ours, as much as we want to be proactive, we wind up playing a defense role because so much is thrown at us that we wind up reacting to it. And we're kind of under the gun on time. Now we have the opportunity to really look and establish that agenda for affordability in New Jersey that here at BIA we are working on right now, and then meeting with all those candidates and explaining to them the importance of that agenda, but also showing them where we have common ground on that agenda, because oftentimes we have more things in common than we do not in common, and we get caught up on the philosophical differences, and then it never allows us to move the ball forward. And I think what is incumbent upon us and what our goal is this year is that we find within that agenda the talking points to approach our policymakers on common ground and say, let's move these common ground issues and let's stop getting caught up on philosophical difference.
And one more question, and that's sort of what I wanted to build upon, because we have always believed that there is a value in sort of having the discussion and talking publicly about these issues, whether or not there is any legislative activity. So I would ask you to sort of build upon what you just said and sort of discuss the value of you and Melanie and as an organization, the association going out and talking about these things, raising the visibility, making the case, doing its research, doing the reports, and even weaving in kind of what the role of Opportunity NJ is. If you could talk again about having the value of having that discussion over the next 12 to 18 months.
No, absolutely. The whole idea of, so let's look at it this way. Let's go back a year to our out-migration report. Okay. When we first released that report, we had naysayers, we had contrarians, we had policymakers who just wanted to dispute our data. We had people telling us that out-migration is not an issue in the state of New Jersey. What are you talking about? And the more we brought the data to the table and the more we talked about it with everybody, whether people purposely drank the Kool-Aid because they believed in what we were saying, or just by nature of the fact that we continued to keep that message out there so clearly that virally it came to them, and out of nowhere it's like osmosis and magic, right? It becomes a top-of-the-mind issue. So all of a sudden you heard, whether it be individuals or policymakers, leaders across state, the discussions about out-migration. You hear the word 2, 3, 4 times a week in many different manners, okay? So sometimes you're successful by just consistently beating the drum on something that is so important that not only do you get those who agree with you at the base, but you get others to just by osmosis start saying, well, of course that's what it is. The affordability agenda is the exact same discussion. BIA needs to be a thought leader on the issue of affordability and what affordability means in the state of New Jersey. And when you're a thought leader, again, people follow you either because they drink your Kool-Aid because they really believe in it, or because it went viral and it's all they're hearing. And it's amazing because you hear all the candidates using the term affordability. Now, we certainly can't say that's because we've been beating the drum on it, okay? But heck, why not? Because we haven't beaten the drum on it. And the beauty of Opportunity New Jersey, and many of our members have heard us talk about Opportunity New Jersey, but if you don't know what Opportunity New Jersey is an unprecedented collaboration of the business community across the state, 15 business associations, who got together to establish a 501c4, which is a grassroots education initiative, not a political initiative, grassroots education initiative, in order to put data and research and information to educate New Jersey residents and business owners and employees, etc., on what does affordability in the state of New Jersey mean and how do we get there. Visit opportunitynj.org. Sign up for the news feed because we are putting information out weekly. We've got case studies up there from business leaders talking about their challenges in the state of New Jersey, and you'll start to hear more about the affordability agenda for New Jersey. But it's because of the echoed voice of Opportunity New Jersey which collectively represents 4 million jobs in the state of New Jersey. And when you have that many organizations and that many people in a consistent message, that's how it goes viral. Grassroots at its best, right, Melanie?
That's right, Michelle. The grassroots actually is the name of the game. Most of the big labor groups understand that very, very well, and business is catching on.
Well, as the clock now hits 11:45, it's time we bring today's presentation to a close. That's all the time we have today. So I'd like to remind all of you who are listening, don't forget you'll be receiving a recording of today's webinar via email, and you'll also be getting the PowerPoint presentation via email as well. Lastly, when you close out of the webinar, a survey will come up on your screen that we hope you will fill out so we can understand how best to provide you important information in a webinar format. Our next webinar will take place next Wednesday, 1 week from today, January 18th, and the subject is Understanding New Jersey Disability Insurance and How You Can Save. You can sign up for that presentation by going to our homepage, njbia.org. If you have any questions, you may email me at pperetzman@njbia.org. That's PPERETZMAN@njbia.org. I'd like to thank our producer, Vinny Civitillo, for pulling this whole thing together for us and doing his usual great job. For Michelle Sekurka and Melanie Willoughby, this is Peter Peretzman thanking you for being with us this morning and wishing you a good day.